imagine walking through an old, misty cemetery at dusk. In front of you stands a strange ancient tomb labeled the Crypts of Cuckoo. The moment you see that name, crypt, cuckoo, your brain should immediately think of Cryptococcus. This mysterious fungus loves to hide in crypt-like environments, and this tomb is the perfect visual anchor for Cryptococcus Neoformans, the organism responsible for cryptococcosis. As you approach the crypt entrance, you notice an explorer standing there. He looks like an adventurer who has come to investigate the crypts, but something about him looks unusual. Around his head is a massive clear bubble helmet, almost like a giant transparent capsule protecting his head. This giant clear bubble represents the most important virulence factor of Cryptococcus neoformans, its thick polysaccharide capsule. This capsule is extremely important because it protects the yeast from the immune system. Macrophages struggle to engulf it, making the organism highly virulent, especially in immunocompromised patients. Because the capsule is transparent, it doesn't easily take up stain. This is why in the laboratory we use a special diagnostic technique, the India ink stain. Now imagine looking down near the crypt entrance. You see a dark puddle of India ink on the ground. Inside the ink, you notice small round yeast cells surrounded by clear halos. Those halos represent the unstained capsule, which appears as a clear space around the yeast. So whenever you see India ink with clear halos, think immediately of Cryptococcus neoformans. Now look around the crypt environment. Perched on the tombstones and trees are dozens of pigeons. They are sitting everywhere, and unfortunately they have left droppings all over the area. A warning sign nearby reads, "Pigeon droppings area, do not disturb." This is another extremely important exam clue. Cryptococcus neoformans is commonly found in soil contaminated with pigeon droppings. Humans become infected when they inhale fungal spores from this contaminated soil. So imagine someone exploring this crypt area. As they breathe in the dusty air contaminated with pigeon droppings, the fungal spores enter the lungs. Initially, the infection may start in the lungs, but the organism has a strong tendency to spread through the bloodstream, and its favorite destination is the central nervous system. Now look back at the explorer standing near the crypt entrance. He is holding his head with both hands, looking distressed. Why? Because he has a severe headache. Floating around his head are soap bubbles, slowly drifting through the air. These bubbles are extremely important. They represent the classic soap bubble lesions seen in the brain during cryptococcal infection. In patients, especially those with AIDS or severe immunosuppression, Cryptococcus can cause cryptococcal meningitis. In brain imaging or pathology, the organism forms gelatinous cyst-like lesions in the brain parenchyma, which resemble soap bubbles. So whenever you see the combination of immunocompromised patient headache meningitis symptoms, think of Cryptococcus neoformans. Now, imagine that doctors arrive to treat the explorer. Near the crypt entrance, you see 3 medicine bottles placed on the ground. The first bottle reads amphotericin B. The second bottle reads Flucytosine. The third bottle reads Fluconazole. These represent the standard treatment protocol for cryptococcal meningitis. First comes the induction therapy. The most effective initial treatment is a combination of amphotericin B plus Flucytosine. This combination rapidly kills the fungus and controls the infection. After the initial infection is controlled, the patient enters the maintenance phase. During this stage, the treatment is switched to Fluconazole, which helps prevent relapse. So remember the sequence. Amphotericin B plus Flucytosine right arrow induction therapy, Fluconazole right arrow maintenance therapy. Now look again at the ground near the crypt. There is a shiny silver plate lying on the floor. On its surface, delicate fungal structures appear etched into the silver. This silver plate represents a special histological stain used to identify fungi in tissue samples. It is called the Gamori methenamine silver stain, often abbreviated as GMS stain. This stain highlights fungal organisms beautifully, making the yeast cells appear dark against a light background. So when pathologists want to confirm the presence of fungal organisms like Cryptococcus, they often use GMS staining. Now let's walk through the entire scene again so the mnemonic becomes unforgettable. You enter the eerie cemetery and see the crypts of Cuckoo, reminding you of Cryptococcus neoformans. An explorer stands nearby wearing a giant clear capsule helmet, symbolizing the thick polysaccharide capsule, the organism's key virulence factor. On the ground lies a pool of India ink, where yeast cells appear with clear halos, demonstrating the India ink negative staining test. Around the crypt are pigeons and their droppings, representing the environmental source of infection, soil contaminated with pigeon droppings. The explorer clutches his head while soap bubbles float around him, symbolizing soap bubble lesions in the brain and cryptococcal meningitis, especially in AIDS patients. Nearby are treatment bottles labeled amphotericin B, Flucytosine, and Fluconazole, reminding us of the standard antifungal treatment regimen. And finally, a shiny silver plate on the ground represents the Gamori methenamine silver stain, used to visualize fungal organisms in tissue. So whenever you picture this strange crypt scene filled with pigeons, bubbles, ink, and silver plates, your brain should immediately recall the entire story of Cryptococcus neoformans, a capsulated yeast from pigeon-contaminated soil, diagnosed with India ink, causing soap bubble brain lesions, treated with amphotericin B and flucytosine followed by fluconazole, and identifiable on GMS staining. And that is the unforgettable story of Cryptococcus neoformans,